I've had the opportunity to be part of a large consortium comprised of several academic leukemia centers in the Chicagoland area, where we are particularly focused on understanding drivers of healthcare disparities in patients with acute myeloid leukemia. Our group published on the impact of structural racism impacting outcomes in patients with AML. But we started to ask ourselves, what are the drivers of structural racism? Can it all be captured by census tract, socioeconomic status, the barriers that come with race, ethnicity? And one of the things that really stood out to us was how could air pollution potentially explain part of this story? So Chicago is a historically fairly redlined city, meaning, unfortunately, many of the neighborhoods that tend to have higher proportions of underrepresented minorities are also in higher polluted areas. So we did an analysis where we identified 5 very common air pollutants that are associated with leukemia risk. And then we looked at a cohort of patients in the Chicagoland area with a diagnosis of AML. We looked at exposure in non-Hispanic white patients, non-Hispanic Black patients, and Hispanic patients, and found consistently that non-Hispanic Black and Hispanic patients had higher levels of air pollutant exposure based on their zip code than those patients who identified as non-Hispanic white. The other thing we found was a specific air pollutant, PAHPOM, was associated with higher risk disease. So we used the European Leukemia Net risk classification, and patients were more likely to be intermediate or high risk compared to favorable risk if they had elevated PAHPOM exposure. Now, I would think of this as primarily hypothesis generating. I think there's a lot more that we need to learn about the impact of pollutant exposure. Air pollution is also a very crude proxy for how much carcinogen or pollutant exposure you have. For example, we know that indoor air pollution is also a very significant exposure that patients have. For example, houses that burn their stoves more frequently than those that do not, et cetera. But I think this starts to kind of build a story around how can we look at the specific environmental features that come with being in a specific part of a city or the environment that you're in day and day that will then potentially confer higher risk features if someone were to develop AML.